This is a historic day, the likes of which we've not really seen in this country in peacetime. And despite the dramatic news, it's been reassuring. We've seen state and federal leaders, Labor and Liberal, work effectively together. That's a good thing, and it certainly reassured the markets for now. And it should reassure the public for now as well. I talked last night about how this virus pandemic was going to change the way we live for a while. Frankly, it's going to be a shocker of a winter. But we'll get through it because we're a hardy and sensible lot. At the worst end of the spectrum is the severe health implications. Yes, we've lost 3 people in Australia already. We'll lose many more. They'll overwhelmingly be people who are elderly or frail at the moment, so we've got to do all we can to protect those people. But a lot of people are going to lose work, lose their jobs. A lot of people are going to lose money on holidays cancelled or through other inconveniences. We're going to miss out on sporting events, on concerts and other events. Our working lives are going to be disrupted. Lord knows how we're going to organise to look after the kids when more schools are closed eventually. But this is it. This is our winter of coronavirus infection. This is what the COVID-19 pandemic will do to us. It is unprecedented. We've never had a pandemic on this scale at a time of such widespread global mobility. And it's so important we don't overreact. It's so important we keep it all in perspective. The disease itself, often described as deadly, well, yes, you could describe the common cold as deadly. For most people, we know it'll be like a mild case of the flu, a severe case for others. And yes, in a bad case, like the flu, it can be fatal, especially for the elderly. But already around the world, 60,000 people have had the virus and fully recovered. Keep that in mind, 60,000 people already. Let's talk about why major events and crowd gathering and travel has been cancelled. It's all about trying to slow the infection so that we don't have a huge spike in cases and overload our health system. That's when people can suffer needlessly, when the system gets overwhelmed and we can't care for patients properly. You might have seen a graph like this one going around. There are a few versions. It just shows that if we get the same number of infections over a short period of time, it will overwhelm the health system, even with the proportionately low number of severe cases. But if we can slow that spread and have the same number of infections over a longer period of time, just maybe we can keep the severe cases to a level that the health system can cope with. That's the plan. That's all. It's about being cautious, safe rather than sorry. Change your lifestyle, stay home if you're sick, avoid crowds. Just do what we can sensibly do to slow the spread of this flu-like virus. On the medical front, calm, order and common sense are vital. Now, on the economic front, as I said yesterday, I don't know that a stimulus package is the answer, certainly not to stopping a recession. I think it's important the government does something to support the economy, don't get me wrong. Measures to keep people in work are going to be crucial, and I think payments for those who can't work are going to be even more important. But I don't think a recession can be stopped. I think the world economy essentially is going to go into dire pause for the next few months as we batten down the hatches and wait for a vaccine to alleviate the situation. None of this can be helped, none of it can be stopped. It just needs to be managed. Now, this requires the nation working together. Anthony Albanese has been largely supportive of the government's actions. Good on him. Scott Morrison has now instituted a national cabinet. That's how serious this is, a weekly meeting of state and federal leaders to coordinate the response here. This is unprecedented, this is bold, and I reckon this is wise.
What we have resolved to do is to form a national cabinet to deal with the national response to the coronavirus. The National Cabinet will be made up of the Premiers, Chief Ministers and myself. We will be meeting on a weekly basis to ensure that we get coordinated response across the country to the many issues that relate to the management of the coronavirus.
I've got to say, the political leadership of the nation, the Prime Minister, Opposition Leader and Premiers, Labor and Liberal, has been generally first-rate today. What we saw has reassured the markets and I think should reassure the community. Long way to go, of course, but perhaps to underline the point, Morrison should invite the opposition leader to join his national cabinet, get him inside the tent, Team Australia. On the fringes of politics, the media snipers still don't get it. The usual media haters of Morrison have been out there trying to blame him for the outbreak, dictate what should be done ahead of medical advice and score partisan points. It's coming mainly from journos who were humiliated by Morrison's re-election. They're so embittered they're looking to get their revenge, even pretending they know best how to deal with a coronavirus pandemic. I kid you not, these people are transparent. Morrison, on the other hand, along with the state premiers, has been acting on the best medical advice, and so far, what we've seen unfold in this country demonstrates they've done a pretty good job. But there is a long, long way to go. What I will show you to demonstrate this ugly political opportunism from the media is a clip from the US that shows how CNN have been completely hypocritical, accusing Donald Trump of being xenophobic by referring to COVID-19 as the Wuhan virus, even though they've used the same term themselves.
You're starting to hear the Republicans, especially Trump calling it the Wuhan or the Chinese coronavirus. They're looking for someone to blame.
Concern is growing this morning over an outbreak of a new SARS-like virus in China. At least 6 people have died from the Wuhan coronavirus.
The Wuhan coronavirus. The Wuhan coronavirus.
The 34-year-old ophthalmologist diagnosed Saturday with the Wuhan coronavirus.
The Wuhan virus.
The Wuhan coronavirus.
The Wuhan coronavirus. What more can you tell us about the similarities or differences between SARS and the Wuhan coronavirus?
The Wuhan coronavirus.
The Wuhan coronavirus in China.
The Wuhan coronavirus.
The Wuhan coronavirus.
And the Wuhan coronavirus.
Wuhan coronavirus.
Fears continue to grow over the outbreak of the Wuhan coronavirus.
And on it goes. There's lots of smartasses in this world, lots of people in the cheap seats trying to take pot shots in a political way over all this. But for most of us, it's about acting sensibly, and for our political leaders, it must be about acting in the best interests of all on the best medical advice.